Welcome to your podcast, The Truth About Exercise. As I'm sure you're aware, exercise and general physical activity are associated with a healthy lifestyle and longevity, as well as overall low levels of inflammation. But did you know exercise can be involved in pro-inflammatory responses in the body? Let me explain. You see, exercise can produce both pro-inflammatory, that means increases inflammation, so pro-inflammatory cytokines, as well as anti-inflammatory, that means decreases inflammation, cytokines. A cytokine is a category of small proteins secreted by specific immune cells, those involved in the response to local inflammation. Exercise done in the right way can activate white blood cells and macrophages. Now, macrophages are born from white cells, which are called the monocytes. Now, this is really important because macrophages have the ability to locate and actually eat bacteria, viruses, fungi, and parasites. So imagine creating an exercise routine that supports your immune system and supports your gut microbiome so you get better. But you see, exercise can also upregulate these pro-inflammatory cytokines and fuel inflammation. So you're probably thinking, well, that's confusing. On one hand, it makes things better, and on the other hand, it makes things worse. Well, it all has to do with the type of exercise. See, just a single exercise session of varying intensity and duration, and that can be as simple as a very long walk, has been shown to induce systemic inflammatory responses. In fact, those that are similar to associated with an injury. How? Because it activates what is called the acute phase response. This response is called the acute phase reaction, and it involves a wide range of inflammatory responses as well as changes in the nervous system, physiological changes, hormonal and metabolic changes. It basically initiates and amplifies tissue inflammation, and this response can continue for 24 to 72 hours after the initial exercise. However, the process can be prolonged and converted into a chronic reaction if the initial stimulus, e.g. the exercise, persists. As a result, a prolonged acute phase response may not only contribute to ongoing tissue damage and a metabolic disturbance, but is associated with a disease that can also lead to further complications. So can you see how when you're already inflamed with your current condition, that adding strenuous exercise further inflames you? Let me explain further how this inflammatory cycle of exercise works. You see, when the body is inflamed, a protein called C-reactive protein made by the liver is released into the blood. Now, levels of this CRP start to rise soon after inflammation, and CRP levels can increase many, like 100-fold, and then drop quite quickly as soon as the inflammation passes. C-reactive protein is commonly used by doctors to monitor inflammation and to monitor the effectiveness of treatment. The average healthy person has low levels of C-reactive protein. However, after a strenuous exercise and initiating this acute phase response, tests show that CRP levels increase up to 10,000 times more over the normal acceptable range. Now, some examples of strenuous exercise are prolonged walking, brisk walking for prolonged periods, marathon training or running, prolonged swimming, jogging, even light jogging, running, marathon or otherwise, cycling, jumping rope, speed walking, either outside or on a machine, hill walking, stair climbing, cross-country skiing, aerobics, CrossFit, gym workouts, heavy lifting. That's just to name a few. You see, over-exercising has been shown to induce chronic systemic inflammation, and some studies suggest many of these signs and symptoms that characterise over-exercise are remarkably comparable with the manifestations of clinical depression and unfavourable changes in mood, behaviour and cognition. You see, any exercise that increases body temperature has the effect of reducing intestinal blood flow and increasing intestinal permeability by activating the sympathetic nervous system, that's your fight and flight, and the hypothalamus pituitary adrenal axis, which is responsible for the release of cortisol, adrenaline and noradrenaline. An example of this is in marathon runners, and this is a relatively slow-paced but long endurance sport. They have displayed a significant increase in intestinal permeability after exercise. Strenuous exercise results in higher circulating endotoxin levels, which can activate the immune system. There's also been further evidence that exercise that induces heat in the body increases intestinal permeability, which can lead to gastrointestinal complaints such as abdominal bloating, pain, gas, and alternating bowel movements. It has been well documented that strenuous and prolonged exercise, again like the long distance running or triathlons, provokes diarrhea and gastrointestinal bleeding. And this excessive training may introduce microecological imbalances via what we call intestinal ischemia. And that is where ischemia is where there is a restriction in blood supply to tissues, which causes a shortage of oxygen that's needed for cellular metabolism. So what happens is this can result in a dynamic change in the gut microbiome, where studies have shown an increase of pathogenic E. coli and pathogenic Prevotella oralis. This is the organism that's been found in patients with periodontitis, which is a gum disease, as well as various sites of human infection where they find the Prevotella oralis. Studies also indicate that it decreases several species of the Lactobacillus genus, which is your beneficial bacteria. And interestingly, the exacerbation of these inflammatory responses can actually lead to muscle function deterioration. So now let's look at the opposite of strenuous exercise. Yep, you guessed it, non-strenuous exercise, which includes activities such as a casual, slow-paced walk, especially in nature, the ocean, river, lake, woods, forest. In fact, exercising in nature is one of the best things you can do for your microbiome, as it actually promotes microbial diversity and increases beneficial gut bacteria populations. Another one is yoga. Just beginner level, up to 1 hour, including warm-up and downtime, and less when starting out, about 15-20 minutes or so. Tai Chi, outside in nature. Pilates, a beginner level, again up to 1 hour, including warm-up and downtime, but starting out a lot less. Walking in a swimming pool. Or light swimming, defined as a slow breaststroke with more than 5 laps of a 50-metre or 54-yard pool with 1 minute rest between laps. Light gardening and yard work, and resistant bands, a light workout of up to about 30 minutes. All these activities lower the stress response, reduce heart rate, modulate breathing, lower blood pressure, and can enhance perfusion of the brain with micronutrients absorbed by the gut. Yoga is especially highly beneficial. Studies concluded that yoga provides a pronounced and significant improvement in perceived stress, reduction in anxiety, pain, fatigue, and depression. And in addition, it increases physical well-being and energy. Research shows that salivary cortisol, which is your stress hormone, when measured after a yoga class, has been shown to be significantly lower. Another exercise, as I mentioned, is resistant band exercise. And these are an important exercise that are used during the GRP throughout all the phases, as it provides a similar and sometimes even greater muscle activity than regular weight training with machines or free weights. They provide a huge benefit as they improve the size, function and strength of muscles. However, they don't put force on the joints, which allows for more stimulus to the muscle, aka a better workout, without the risk of injury. Moderate training has a beneficial effect on the diversity of bacterial species inhabiting your gastrointestinal tract, and has been correlated with a high diversity and increased level of bacterial genes which are involved in protein and carbohydrate metabolism and short-chain fatty acid production. All of these non-strenuous exercises have a positive effect on brain function and have been shown to improve mental health by modulating inflammation and affecting tryptophan metabolism. So can you see how all this low intensity, short duration calming exercises are an extremely important element of the GRP? In fact, a 2006 study titled Gut Microbiota Modification, another piece in the puzzle of the benefits of physical exercise in health, states, the balance between the immune system and commensal microbiota is essential for maintaining health, and the breaking of this equilibrium can trigger many diseases, not only related to gastrointestinal systems such as ulcerative colitis, Crohn's and colon and gastric cancer, but also other diseases such as metabolic syndrome, type 1-2 diabetes, allergic diseases, atopic eczema, dermatitis, asthma, as well as rheumatoid arthritis and autism. And it further states that given the close relationship between the microbiota and the immune system and its involvement in several diseases, it is essential to know which factors modify gut microbiota, and exercise seems to be one of them. That's pretty conclusive. Therefore, your new exercise routine is a key lifestyle strategy used in the GRP to assist in restoring the health of your microbiome and you. So much so that just like the food prescription, there is an exercise prescription outlined in your gut health library that you are required to implement and record daily on your learning module sheet. To find out what your exercise requirements are, what to avoid, what to include in each phase of the protocol, please head to your gut health library and read the section, What Type of Exercise I Can Do. That's it for now. I look forward to receiving your learning modules with your exercise listed and you putting it firsthand to the test and seeing the amazing benefits it's going to bring you. See you in the GRP Virtual Clinic. Bye.